Dive into the world of medicine with the Patient's Guide podcast, where we simplify the science and uncover the research behind medical topics.
Welcome to the Patient's Guide. We're here to help make healthcare topics a bit less confusing.
That's the goal.
Today, we're doing a deep dive into something you get when you leave the hospital, those discharge instructions.
Right, the papers that tell you what to do next.
Exactly. We're looking at whether they're actually easy to understand. There was a recent study on this.
Yes, a study focused specifically on instructions from a system called Epic. It's a really common electronic health record system many hospitals use.
Okay, Epic, got it.
Yeah,
So they looked at how easy the instructions are to read.
that and also what languages they're offered in. Both really important factors.
Makes sense. Because, you need to be able to read it and understand it. Is there a standard for how easy this stuff should be?
There is. Big health organizations like the AMA, the NIH, the CDC, they all recommend patient materials be written at or below a sixth grade reading level.
Why that specific level?
Well, the idea is to reach as many people as possible. Health literacy, how well someone can understand health information, varies a lot. The average reading level in the U.S. is actually around 8th grade.
Oh, interesting. So even the average person might find things tricky if they're written higher than 6th grade.
Yeah, especially when you're maybe stressed or tired after a hospital stay.
Good point.
Yeah.
So what does the study find about these EPIC instructions? Did they meet that 6th grade goal?
Mostly no. For the standard English instructions, they found a pretty high percentage were written above that recommended level.
How high?
On one readability test, the Flesch-Kincaid grade level, over 80% were too complex.
Over 80%.
And on another test called SMOG, it was actually 100%.
100%. So basically none of the standard instructions met the goal on that measure.
According to that specific measure, it suggests they could be quite difficult for many patients to really grasp.
What about languages? You mentioned they looked into that too.
The good news is they found instructions in 15 languages overall, and Spanish was available for pretty much all the documents.
Oh, Spanish availability is good.
Yes. But for the other languages, think Russian, Portuguese, French, Vietnamese, and others, the availability was much lower, often less than 35%.
Less than 35%. So if you speak one of those languages, you might just be out of luck.
You might not get the instructions in your primary language, creating a barrier to understanding your care.
Right. Now, sometimes there are easy-to-read versions. Did the study look at those? Are they better?
They did look at them, and yes, the easy-to-read versions were significantly easier to read than the standard ones.
Okay, so that's a positive finding.
Only about 20% of the English and Spanish documents had an easy-to-read option.
Only 20%. And for other languages?
Even less common. Availability was below 3% for easy-to-read versions in languages other than English and Spanish.
Did things get better over time? Did they check if updates improved readability?
They didn't find significant improvements in readability over the period they studied, even though the documents were revised sometimes.
So it seems like making them easier to read just hasn't been the main focus.
That appears to be the case based on the study's findings.
So let's bring it back to the listener. Why does this matter so much? If instructions are hard to understand,
Well, think about it. If you don't understand how to take your medicine, or when your follow-up is, or what symptoms mean you need to call the doctor.
yeah, you can make mistakes.
Exactly. It can lead to confusion, maybe more phone calls to the clinic, which takes up time. But more seriously, it's linked to higher chances of having to go back to the hospital. Readmissions.
It really highlights how crucial clear communication is.
Absolutely. This study is basically calling for healthcare systems to put more effort into simplifying these instructions and making them available in more languages.
So the key takeaway here is that those discharge papers are vital, but they might not always be as clear or accessible as they need to be.
Precisely. Something for hospitals and maybe even patients to be more aware of.
We hope this gave you some useful insights into this issue. Now we're curious about your own experiences. When you or a loved one left the hospital, were the instructions easy to follow?
Were they in the language you needed?
Let us know your thoughts. Head over to the comments section and share your experience.
If you enjoyed this episode of the Patient's Guide, you can find more below.